In the past decade, cancer care made great progress with the advance in research and in medical technology and in precision medicine, as we saw in our panel yesterday. Locally, Qatar launched its national cancer strategy a decade ago, and through this panel, we will go over the achievements and the challenges. Welcome, everyone, wherever you are. My name is Rawa Oje, and I will be your host for this panel, part of Wish 2020. Everyone who was personally touched by cancer as a patient or as a close person to a cancer patient will tell you, if only we found out sooner. If there's one thing we need to accomplish in the coming decade, is to get people from being aware about the importance of early detection to actually take the step and go for early screening. Information is also not an easy ally. We need to work on an accessible, validated data, because after your first chemo session, you tend to want to believe any information that gives you another option away from nausea and fatigue. Surviving cancer doesn't end by defeating it. We need to support survivors through physical and psychological side effects. Meanwhile, all these amazing doctors and researchers and nurses and therapists are working out a better holistic approach to improve cancer care. To talk about all these efforts, I have with me in the studio Sheikh Dr. Mohammed bin Hamad Al Thani, Director of the Public Health Department at the Ministry of Public Health in Qatar. And we have from Jordan, Her Royal Highness Princess Dina Mirad, patron of the International Society for Pediatric Oncology and the immediate past president of the Union for International Cancer Control, and also a member of WHO expert group for the elimination of cervical cancer. We have with us also from Doha, Dr. Sheikha Abu Sheikha, the manager of the cancer program at the Primary Healthcare Corporation, and Dr. George Nimr, professor and coordinator of the Genomics and Precision Medicine program at the College of Health and Life Sciences at Hamad bin Khalifa University. Feel free throughout the panel to send us your questions and to whom you would like to address it. We will try to make this conversation as interactive as possible. Each member will answer my first round of questions within 3 minutes. Then we will move to your Q&As. So make sure you send us your questions as soon as they come to your mind. And we will wrap up in the end with hopefully concrete recommendations and actions to be taken to move forward. So let's start with the WISH report about Qatar's progress in cancer care with you, Dr. Al Thani. Could you give us an overview of the report for this year?
Okay, thank you, Rawa. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good evening for everyone. I'm so glad to be here in WISH during this period, and we're so glad that the virtual event is doing great till now, and always, inshallah. So regarding the cancer report has been documenting all the situation in Qatar in the last decade. And in a brief, you can see that our first strategy was cancer strategy in 2011 by the vision of Sheikh Hamza bin Nasser has been directed us to do this. And by support of Lord Darzi, this strategy was being started in 11. And it opened for us many strategies to be done since that time, with guided to the vision of Qatar 2030, that Qatar was the first maybe country in all the region to start the Vision 2030. Cancer strategy has been the first one to have changed the situation by a strong leadership will from the high authority to care about cancer, and the same thing, doing the proper governance structure and giving the capabilities and increase the capacity to deliver what's needed through cancer. Before, cancer was only in the National Cancer Center, but now it's multidisciplinary team working through the country. During this strategy, we have been looking for different things. Cancer in Qatar, when we do all the analysis, we found it was the third cause of death after injuries and after cardiovascular. But alhamdulillah, during these 10 years, the injuries have another strategy and has delivered to be much lower injuries and road traffic accidents. So now we are ended by cardiovascular as number 1 and cancer is number 2. And although cancer is number 2, still the risk of cancer and people are concerned about dying or suffering from cancer more than cardiovascular. So assuring people and put them in the right track and make them trust in the system of Qatar was so important for us. When we did other analysis, we understand that the highest cause of cancer in Qatar is breast cancer. It's around 70% of the total population and more than around 20% of the Qatari population. The second one was colon cancer with 10% for the whole population and 12% for the Qatari population. So this analysis of the statistics help us to invest where we should start our screening test. And this was one recognized in the strategy that we need to care about prevention, treatment, high quality treatment, assure that there is palliative care and research and survivor, taking care about the survivors mentally and bringing back the society very healthy. All these points give us a holistic approach for cancer in Qatar to work together. It seems easy first, but when you start working on it, it's so sophisticated and need a lot of good willness between different sectors that we are proud in Qatar that this happened, and we recommend this experience for all other countries. You can always start small, but you can grow for this gradually. But we started now for around 4 years now. We have 3 things for screening. We support breast cancer screening and bowel screening, plus cervical cancer screening. All these helped in high survival of breast cancer. Our surviving cancer is around 85%. It sometimes go to 89, but always above 80% because early screening encourage people. So the worries before from the ladies to go for screening now is much less. We work a lot on prevention, on awareness campaigns to refute myths, and this helps us people to get used for the test. Although we see 50% from the women acceptance more than the bowel for men, still 30%, but it is growing gradually and the trust is happening always. And we are so glad that we dedicated more beds for palliative treatment, and now we are not just treating people and leaving them to the society. There is a support. We thank Cancer Association even supporting us to grow and help these people to come back to life. And one of the blessings in Qatar that, alhamdulillah, we don't have any people to pay catastrophic payments. Although cancer is concerning people even about the suffering and the payments, but Qatar as country and government responsible to cover most of the payment of this. Some people may pay a few amount because different criteria, but they are always supported when needed support to be paid from other. And this helps people to lower the two double worries between the payments and the suffering from the disease. All these things help. We have now more than 14 multidisciplinary team working in the hospital, and we are moving forward with the governance structure to make it more accurate and more timely mannered for everyone to get the result as soon as possible. We are proud we have a registry system. One of the strongest registry system in Qatar is cancer registry. All these things are helping us to move forward in the last decade to what we want, and we are looking for more, inshallah, to 2030.
Inshallah, the cancer registry helps you also go for members of the family and push them to go for screening even if they don't have any symptoms, and that's amazing for early detection and prevention. Your Royal Highness Princess Dina Mirad, patron of the International Society of Pediatric Oncology, my question to you is, you have a long track record of international advocacy efforts for cancer patients and their families, including personal experience as the parent of a cancer survivor. Despite all of the progress that seem to be made, in which areas do you think cancer programs can make further improvements? Your Royal Highness, I think you need to unmute your...
Yes. Thank you so much for allowing me to join you on this important panel. Yes, also as an immediate past president of the Union for International Cancer Control, aside from my personal experience and the fact that I was the former director of the King Hussein Cancer Foundation in Jordan for 15 years, being as president of the Union, I had traveled far and wide, and I really got a new perspective from many countries, whether low, middle income countries or high income countries. And I really want to thank Qatar for really leading the way and after having read the report that was written for this panel about Qatar's achievement, it's really fantastic what Qatar has done. And I know some people might dismiss it and say, oh, but they are a rich country, they have the money to do so and so. I don't agree. Yes, they don't have the barrier of the financial resources, but they really, I really think that their achievement is because they've done everything systematically from 2011, from putting a proper cancer strategy, um, going for universal health coverage, focusing on prevention, focusing on early detection. They've really done everything systematically. They've even done a strategy for cancer research and immunotherapy, the genome project, and so on. They've done the boring bit. They've gone down, hunkered down, thanks to a really great vision, articulate vision for cancer strategy in the country, great political will and leadership from Sheikh Moza and the government of Qatar and so on. And they are where they are because they did the proper they put their vision into an articulate action plan and they've implemented. And that's really kudos to them because I've seen countries maybe have more money than Qatar and they did not achieve what they have achieved. They might be able to buy expensive equipment or build fantastic infrastructure, but that alone was not going to solve it. Qatar has done a holistic, comprehensive approach, looking from prevention to early detection, treatment to palliative care to survivorship. And that's really the message that I will keep on advocating. The fact that you need to have cancer control plans, you need to have cancer registries, you have to look into the system and do the boring bits so that you can achieve results. And I think now, now that I finished my presidency, I will continue advocating, certainly now to be able to regain the losses that we have had because of COVID-19. As you know, there has been delays in diagnosis, early detection. There have been funding being cut for cancer research, for cancer organizations all over the world. We, the cancer community, definitely have taken a beating in that, and we need to advocate, all of us, including Qatar, to make sure that the gains that we have made are not lost. And not only that, to continue moving forward, because cancer does remain the second leading cause of death all over the world, killing millions of people. And we need to keep cancer on top of agenda.
On top of the agenda, and especially early detection, early prevention, because it lowers the death rate drastically. Thank you, Your Royal Highness. We'll get back to you with more questions. Dr. Sheikha Abu Sheikha, you manage the cancer program for PHCC. Can you speak to the challenges and keys to success in implementing the national breast and bowel cancer screening programs?
Yes, we have a lot of keys, success keys that we have learned in implementing the breast and bowel cancer screening in Qatar. One of the most important thing was the focused marketing campaigns that was done. It was done internal in PHCC for the healthcare workers to increase their awareness regarding the breast and bowel cancer screening service, to increase the referrals from doctors' clinics to the screening services. Also there's the external marketing to our public, to our ministries, to our colleges, and specifically focused to our target group. Our target group is 45 and above for women, for breast cancer screening, and for bowel cancer screening is 50 and above. So our marketing campaigns were targeting those groups according to the age, according to their favorite places they like to go. So we've developed marketing campaigns targeted for those people to increase their awareness and motivate them to come and to do the screening. Second thing, we have established a dedicated call center with fully automated, with all the data of the population, with all the data of our target group, and it's equipped with several schedulers. Our schedulers are very trained to communicate with our target group, to motivate them when they call them, and to schedule appointment for them for the screening service. We have called around 80% of the total population and scheduled 70% of them. Also, in addition to the call center, we worked on the cancer screening services for the breast and bowel it's a patient-centered care. We were planning this service with the patient in our minds. So first we started with the location of screening. It's in a geographical areas in Qatar, so it's easier and accessible for our target population to come and to do the screening. And the actual screening suites, they are a spa-like areas. So when the participants they come to do the screening, the amount of fear would be decreased. Also, in addition to the in addition to our spa-like screening suites, we have worked on our cancer screening service. We made it so seamless between us in primary healthcare and Hamad Medical Corporation, where the screening is done actually in the primary healthcare. And if there's any abnormal results in screenings, they are referred directly to Hamad Medical Corporation. Also, the service, as Sheikh Dr. Muhammad has said, our service for the screening itself, it's totally free of charge, which motivates our target group to actually come and to do the screening. Satisfaction survey is part of our program. We need to be fully aware of the experience of our participants when they come to our services. We need to know how they felt. Did they feel taken care of? Were they worried? So we can taper our service according to their experience. Monitoring and evaluation. I cannot stress on that point enough, because the continuous monitoring and evaluation is very important to keep the improvements going in all programs. And we've been doing this from day one, and we've been involving patients in our screening services and in our meetings, in marketing meetings, in our program improvements meeting, to make sure that we get all their feedback actually implemented and make them feel as comfortable as positive as possible. In addition to this, we made sure that all the IT softwares that we have between PHCC, HMC, and Ministry of Public Health is fully integrated. We know data is very important in so many ways, in developing the KPIs, in monitoring the service, in future researches. So we focused on this area. Also, in addition to that, as Sheikh Dr. Muhammad has said, we have a strong governance to monitor the program. The governance includes PHCC. We have internal governance to manage the screening internally. Also, the strong governance we have with the multi-sectors in Qatar, with the Ministry of Public Health. We have the Qatar Cancer Society. Also, they are part of that governance. Also, private hospitals. So we make sure that everybody is involved in this governance, and if there is any lessons learned, we share it with everyone. Any obstacles, any issues we have, it's escalated, and everybody is working as one team. We're not working with this as in it's different organizations. We're working with this as it's one program, and it's been working very well. Regarding the challenges, we've said that we have implemented the IT integration for in all health sectors. It's easy said than done, but it is doable and it is worth it. And also, as Her Royal Highness has said, one of the challenges is the COVID-19. COVID-19 has caused us to stop the service for a while, but now also we are planning for the restarting, making sure and everybody they are comfortable to come back after the COVID-19 pandemic. We need to study the situation. We need to understand how people will behave after the COVID-19 when we ask them to come and actually do the screening. So inshallah, it's going to work well, and hopefully we're going to get back again. Yes.
Inshallah. Thank you very much, Dr. Abu Sheikha. We'll get back to you now. Dr. George Nimr, the professor and coordinator of the Genomics and Precision Medicine at the College of Health and Life Sciences in HBKU. Dr. Nimr, might you be able to discuss some of the most promising areas in terms of future cancer care coming out of the Genomics and Precision Medicine program at the HBKU?
Okay, good afternoon, everybody. Thank you again for giving us the opportunity to talk a bit about some of the aspects that are going to touch the patient at the end, and this is what we care for. We are an education institution, but at the end, you know, our research is going to touch directly the patient, their family, and of course, the health policies and everything related to its implementation at the level of the hospitals and all the companies that are involved in that aspect. So I don't want to get into the details about the science, but I'd like to share some of the information because this is very important and key to all of us as educators, sharing knowledge. And this is the important in this area where, knowledge, if it's not shared, it's wasted. It's not going to be counted. So I'd like to highlight some of the important research aspects in our college, and it's done mostly through collaboration with basic researchers and physician educators at different hospitals, at Sidra, at Hamad. And this is very important because we need to bring, again, research from bed to bench and from bench to bed again, so that the patient can benefit and the society can benefit at large. Number of issues related to cancer are centered around early diagnosis and, of course, treatment and prevention of relapse. And these major focuses are, in fact, divided in our research group into people or researchers who are involved either in setting up some of the earliest biomarkers, so to really come up with diagnosis early on, trying, for instance, to come up with a new test that are non-invasive. I'm going to give an example of lung cancer, for instance, and you know that it is a growing challenge for the people in the region with the growing, use of shisha. Smoking shisha in our area is really very challenging, and people are not taking it seriously, and it's going to affect the population at large. Women in particular, are getting into shisha smoking without even knowing the impact of that on their health. And again, the problem with lung cancer is that when you are trying to detect it, it's going to be too late. And the issue is that we need to find out some new non-invasive, test. We're trying to work on tests that involve sputum instead of going into biopsy, which is going to be too late when you are going to diagnose lung cancer. And this is one area where my research team is involved, and we are trying to come up with a new method to really have a detection method into the sputum, whereas you are not going to really have problems in degraded nucleic acids, because this is the challenging spot in getting the sputum. Other area of research that are developed in our college are related to really understanding the genomic and molecular mechanisms underlying some of the relapses that are seen, mainly again in the vulnerable population. We are looking at pediatric patients, those that are suffering from acute myeloid leukemia, whereby there are some driver mutations that can predict some of the relapse, but most of the time we don't know why we are going to have these relapses. And researchers in our college are focusing on understanding the epigenetic regulation of these relapses, in addition to those genetic scoring that have people being used in order to understand relapses. Last but not least, of course, is the response to drugs. And as you know, that most of the patients are going to respond differentially to the different drugs that are in the system. And that's why, the knowledge of the genomes of each individual, going back to the personalized or precise medicine, is an important feature that we are looking at in our college. We need to establish for each individual what are the genetic variants that are responsible for the response or the non-response, so that we can administer the best dose or the combination of drugs that is important. And again, our research is focused on developing AI-based, applications that would help the physician figure out what is the best drug for the treatment and for the follow-up of that treatment in the different patients. And again, I'm going to focus on sharing knowledge. Without sharing knowledge, we cannot reach up to everybody in the society and improve healthcare. Thank you.
While we will look into the future, thank you, Dr. George Nimr. This year we were suffering from the pandemic. Her Royal Highness Princess Dina touched on the impact of COVID-19 on providing cancer care and on providing treatment. Dr. Al-Thani, how much of an impact has the pandemic had on cancer care screening and services in Qatar?
Yes, thank you. As we thank Her Royal Highness Princess Dina for the comment about the systemic approach that Qatar is doing. And really, they were doing this by the support of the national experts and the international experts like her to assure that Qatar is always on the right level. Of course, COVID affected everything because we were concerned how much COVID can even hurt cancer patients. So there was very keenness to protect all the cancer patients in the center. Cancer center, and there was a very strict system to protect them. And for the alhamdulillah, and thanks to Allah, it helped us that we didn't have any outbreak inside the cancer hospital. This can affect all the people, but alhamdulillah, it didn't happen. This is something very important. We were worried that people that can be affected in their meeting. There was very keenness. There is a call center. They were calling and they were meeting. Of course, we were affected a little bit with the screening that Dr. Sheikha has mentioned. Screening people routinely has been freeze for some time. Everything now is moving gradually to normal again, but this was affected. And we are always balancing in Ministry of Public Health between the COVID risk and the people who are not going to the primary health care or to secondary care to take their drugs as early as possible. I would like to encourage everyone now again to come back, and if you have any concerns, please test. Don't delay your test, because we have been achieving in the last 10 years to find more cases in the first, second stage of the cancer, and before it become in the third or fourth stage. So this thing, that achievement that we have been doing, we would like to protect it and keep people early coming for screening and supporting people by phone call if they cannot come sometimes to be in the services in primary health care or in the Cancer Association Center. Thank you.
Your Royal Highness Princess Dina, we have a question for you. What is your perspective on the importance of involving cancer societies and patient support societies in national cancer plans?
I think their inclusion is very important because they bring the voices of the patients to policymakers. And I think that's what Qatar did. You know, when you talk about patient-centered approach, you really have to have everybody sitting on the table. You cannot talk about us without us, as they say, right? You have to have the patients, the NGOs, the private sector, the scientists, the oncologists, the government, etc. Everybody sitting on one table. If you really want to have a fantastic and really meaningful cancer control strategy, and I believe this is what Qatar said. And I know as UICC, you know, we've had great collaborations with the Qatar Cancer Society, you know, led by Sheikh Khaled. They're great members, and I visited their headquarters, and I've seen the amazing work that they do. And actually, during my visit, I have visited so many, I would say, the best kept secrets of Qatar, and I was really shocked how much you guys have that we don't know about, even though we are in the same region. You know, I visited the Qatar Cancer Fund, the Qatar Biomedical Research, and so many other institutions. I was amazed, and that is why I really feel that Qatar can take a huge regional role in, you know, being the engine that showcases actually what I would say how the seriousness and the vision of the government and the political will that is afforded to it, and how you all work together in a very systematic way, not only with the local stakeholders, but also with international partners to actually work, you know, to bring innovations as well to the Arab world in the region. And I think that's really commendable. You know, many of us in the region think of, for example, innovations and immunotherapy or genomics as, you know, something really far down the line, when in actual fact, we have so many fantastic Arab minds in our region that are not utilized. So I really feel Qatar could do a bigger role, especially in innovations. But I would also like, and also hearing from Sheikha Abu Sheikha, is the fact that Qatar, yes, they have the money to bring in really costly and expensive innovations, but they still focus on the fundamentals like prevention and like early detection. I commend their population-based
I was
early
actually
screening
going to
program.
take your I was going to take
Yes.
your proposal of becoming a regional hub to Qatar to Dr. Abu Sheikha exactly, and to ask her from your experience in the field, and if we want to put Qatar as a regional hub for cancer care, what are the main challenges we need to focus on while moving with future plans? You need to unmute your...
Yes. Yeah, regarding future plans for the breast and bowel cancer screening program, for us, the service itself, it is done in PHCC, and any further investigation is done at Hamad Medical Corporation. So one part of this, we want to do the ultrasounds for the women for breast cancer screening. If the results were abnormal, to do it at primary health care to decrease the level of anxiousness from them waiting for their appointments at HMC. Also, another future plan for us is to do the artificial intelligence for the reading images for breast and bowel cancer screenings. So this is the future for the reading images. So we're planning to get it in now, and we are in the process of studying this proposal. Also, another thing is the fourth site. We want to open a fourth site in Doha, Qatar, and Mu'aydar to cover all parts of Qatar, so it would be more accessible for our population. In terms of making Qatar as a hub in the region, we are more than happy to accept any visits who wants to come and to visit our service. It's a holistic service starting from marketing, population-based and a dedicated call center, which is fully equipped with all the data that's needed to actually call, recall, schedule. Even the nurses are available in our call center, which I think this is a very good place to start with. If you want to do a population-based screening services, you want to do a call center. You want to establish a call center that has all the data that's needed. Also, you have to employ the proper trained schedulers, and you need to have nurses who can answer all the questions from worried participants. So if anybody wants to visit our service, we are more than happy to do it. We have done several quality assurance visits from outside countries, and we have been supported by the quality assurance visit has been supported by the Ministry of Public Health. When they came and visited our service, they were so happy with it. One of the comments was they didn't believe how fast we did this service and how the quality and the standards that it's implemented in state of Qatar. Also, the IT integration with the Qatar registry at the Ministry of Public Health, this is a very good step. So having a full IT system with the data flow starting from a call center in the service to the cancer registry at the Ministry of Public Health, it's by itself, it's a success for the program. So more than happy to accept
And
any
definitely for
visits who
people
wants
who
to
are
come and see
outside
us.
Qatar. Yeah. Yes. And they can benefit now from the infrastructure that was used and put in use during COVID-19, from following up online and from distance and by call center. And it made, in a way, it made life easier for people who are abroad to benefit from this health system. Dr. Nimr, where does the small size of Qatar's population come as an advantage in cancer care, and where is it an inconvenience?
I think the idea is that when you have a homogeneous population, it's easy to work in the genetic field. And when you have the genetic component, it's easy to come up with targeted therapy. And again, that in a way or the other is more into getting into focus into the individual need for each patient. Now, of course, when you want to compile data, you need to have as much recruited individuals in a cohort as you can. And that's why probably to come up with a solution, we need to have collaborative work between our Qatari cohorts and other cohorts in the region so that we can come up with data that, can tell us if you want to go with that drug, modify the regimen here or there, and this is needed in terms of future collaboration to come up really with good data.
Thank you, Dr. Nimr. Dr. Al-Thani, like Her Royal Highness put upon, you have so many technology assets. You invested a lot in research and cancer care, but still you have patients who go abroad for health, for cancer care. How can you build the trust? How can you maybe advertise and market the services you are building, this huge infrastructure you're building for cancer patients?
Yes, always this important point should be discussed and thoroughly to be understood more about deeper. As you know, after we start screening, people are getting aware about cancer and people testing, the number of cases automatically fully increased because these cases becoming cancer, but they will not die because they will be treated, but the number is increasing. So we are welcoming everyone to come, and as soon as possible, they should take an experience at 48 hours and to be tested. And this makes it a bit busy. Our center was prepared for less number of this, and now we are welcoming more people. We are increasing our capacity, but part of it is that part of our patient, it's acceptable to travel to keep the balance, give a better care for the other that are the hospital is most of the patient capacity is almost fully most of the time of the year because of the trust. And I would like who is traveling outside, they are not traveling only abroad. They are only going to maybe the best 3 to 5 hospitals in the world. Mm-hmm. They will not accept to go to the same country to another hospital. They are just getting from the brand of the best 5 hospitals in the world. At the same time, it's a word of mouth. Many people were treated in these 5 hospitals around the world maybe, and even less maybe, and they want to go like their uncle, their cousin. It's the brand and that's the strong word. And some people just to get another opinion. Many of people when they go there, they are asked, why don't you go back to Qatar? They have the same protocols we have, and many of them are convinced after they go and to feel better, and they come back to Qatar to get their chemotherapy. Sometimes you don't have all the type of very sophisticated surgeries for every type of cancer. So this is happening in all around, even the advanced world. Something are treated in another country because there's a special surgeon for something. So they do the surgery and they come back to get all the additional treatment in Qatar. And as Dr. Sheikh and Dr. Princess Dina mentioned, we are caring now about prevention. This is happening for everyone in Qatar. Mm-hmm. And we are caring after the treatment, for all the patients, after how to take care about them. This will not happen outside the country. Mainly when they are outside the country is the time of a surgery or of the first 1 or 2 months of the chemotherapy. After that, we are handling all the other logistics to be in Qatar for them and make them feel more happy between their families in Qatar.
Your Royal Highness, I have a question. You might be the only one in the panel who could answer this. We have a question from Osman Farouk. He's asking, are there plans to start such projects like awareness about cancer and cancer care holistic programs in developing countries like Pakistan?
I think the government of Pakistan, I'm sure they are planning to do something for early detection and prevention. I know they have major, financial challenges and so on, but they do have a sort of a fantastic team in Pakistan. Certainly, I know your previous health minister, Sania Nishtar. She's a big brain in the global world, and I know. I don't know too much about Pakistan, in detail, but I know you have fantastic human resources in terms of doctors, oncology doctors, and you have a great cancer center in Pakistan. and so on. But I don't know if, what are your particular challenges, and I hope that they do, because that's the only way you're going to reduce mortality from cancer, if you focus on prevention and early detection. You really want to close the door on cancer before it's able to go in and wreak havoc. If I may, I just want to go back to
we're in our last 5 minutes.
Yes.
Sorry, because I'm sure you advocate for survivorship programs, so I want to give you the time to speak about that. Where do you see there is still room to work on and to improve cancer care in terms of survivors?
Absolutely. Certainly in the Arab world, I have, as a mother of a cancer survivor, there isn't really, I haven't seen, and I don't know, I know Qatar, you told me that you have worked on such a program in the proper way. I haven't seen in many Arab countries that they have truly a survivorship program. Usually survivorship here in our countries really stops when you blow the birthday cake and you say, hey, well done, you finished treatment, off you go. And that is not really what survivorship is. Don't forget, many children who have had so much toxic treatment in their system actually suffer from physical, not only just mental issues, for them to get back to their normal, to lead a new normal in their life, but they also have potentially physical issues that they have to contend with, like a weak heart, lungs, perhaps thyroid issues, skin issues, etc. And so you kind of need a proper program that these children or survivors are able to be checked out on an annual basis, and for governments also to actually pay for that service. Many governments in our region think that the minute you stop chemotherapy, it's over. Goodbye, go and manage on your own. And not many people can do that. So that is one area I feel that needs a big focus on. And as we are seeing more and more survivors after all, right? Mm-hmm. Before, in the past, they used to die in droves. Now we see more and more survivors who are living beyond 60, beyond 70 years of age, and we are understanding more and more their physical and mental issues. So that area needs a lot of focus still.
Yeah, we need to be there for them, because it's not easy to feel also betrayed by your own cells and body, and it's not easy, all the side effects on their immunity that they have. Dr. Nimr, this year investment was cut because of COVID-19. It was diverted towards the response to pandemic, but at least even if research in cancer and other programs was cut, there's a bigger awareness globally that we need to invest more in the health sector. We need to invest more in the human workforce, also in the medical sector. From cancer care point of view, where do you see there should be more investment financially and humanly?
I think, as mentioned by our colleagues, COVID hits everybody, and cutting the budgets, is going to affect cancer research. Yes, it did affect it, but at the same time, because of the research on repurposed drugs, some of the drugs that have been used in cancer are now probably potentially being used into COVID, treating COVID. This is the beauty of science, is that you can sometimes mix up things and come up to the advantage of one disease or the other by, looking at this. And this is where I advocate to put more efforts and put more personnel and more even money into looking at these repurposing of drugs. I guess drug repurposing based on AI, artificial intelligence, and other bioinformatic tools is the key for a successful transformation in the health system. And this is where, our college is trying to lead or build in, and we are trying to come up with a new program for graduate students tailored into translational bioinformatics, whereby the knowledge in bioinformatics that we acquired and interaction with the School of Engineering by incorporating artificial intelligence would lead to a better design for treatment for cancer patients and follow-up. Her Highness did mention the follow-up is a key important feature that we need to follow on. Yes, because when you are doing chemotherapy or you're giving radiotherapy, you are affecting also the normal cells in your body, and affecting these cells will lead to premature aging, and this is where the life of the patient is going to be again at risk, because you are going to contribute to premature aging that we need to really regulate in order to have a better life for these patients.
And there's so many more side effects. Thank you, everyone. I have to wrap up quickly because we're running out of time. Thank you to my distinguished guest, Sheikh Dr. Mohammed Al Thani, Director of Public Health at the Ministry of Health in Qatar, Her Royal Highness Princess Dina Murad, Patron of the International Society of Pediatric Oncology, and immediate past president of the Union for International Cancer Control, and also member of WHO Expert Group for the Elimination of Cervical Cancer. Dr. Sheikha Abu Sheikha, manager of the cancer program at the Primary Health Care Corporation here in Qatar, and Dr. George Nimmer, professor and coordinator of the Genomics and Precision Medicine program at HBKU. Thank you, everyone. Tune in tomorrow for another panel, and just shortly, a keynote from Morgan Freeman. Stay with us.